I know plenty of ADHD people who have stuff, and I know plenty of non-ADHD people who have stuff.
Everybody brings in stuff to the relationship. Like both people need the compassion that we're carrying stuff. And I rather say, like, put it all on the table, I'll dump it over here, and now we can carry it together. You're going to be in your boat, and I'm going to be in my boat. That's like roommates. You know, who wants to do that? So we're going to just dump everything together and say, okay, right, we're going to paddle.
Everybody, I am really excited today to be speaking with somebody who I know personally. She's one of my absolute favorite sessions to attend at the ADHD International Conference. She always makes me feel better about life. You know, she's one of those people. Lisa Rabinowitz. She is a licensed counselor and couples counselor. And we're going to talk today about how ADHD affects relationships. Lisa, you and I were just chatting before we started about, some counselors that I hear when they talk about, marriage and relationships, they tend to blame everything on the ADHD person and their traits. And you don't do that. And that's one reason I always listen to you.
I'm so glad. Thank you, Caroline, first for having me here. And I do not want everyone to focus on one person in the room, and that, of course, is going to be the ADHD partner because they aren't doing something right. So we talk about we're a team, we're a partnership. This is about both people, and how do we both show up? And that is why we worked so hard. Well, I'm sure we'll talk about my book, but I did have 15 communication challenges for the ADHD partner, but I had 8. I was like, I am determined to show that the other partner has challenges too. And so the non-ADHD partner, now of course we have 2 ADHD partners. It could just be a mix of a lot of things in there. But there's lots of choices. Yes, we don't want to focus on one person because that's what they've had from childhood. They were the one called out in class for disturbing it. They were the one that, was the problem at home. And it just continues to perpetuate the problem of, or the idea that he or she is the issue, the problem. If we could just fix this person, then everything would be okay. Not true.
Not true at all. And your book is Stop Interrupting Me, which I think is like the most brilliant title ever. And by the way, I've interrupted my husband like at least 30 times today. And I work on it every day. And some days I have off days.
Yeah.
Like I have days where today I finished all my citations for my book. So my brain's kind of fried. Yeah, yay. But it is a thing that we don't mean to do. And that's the reason I love having the traits for the non-ADHD partner too, like you do, because honestly, I know plenty of ADHD people who have stuff, and I know plenty of non-ADHD people who have stuff.
Totally. Yes. Look, everybody brings in stuff to the relationship, and if we don't identify our own stuff, of course, it's easier to focus on our partner's stuff. Who wants to think about our stuff? We just want to focus on them and what they're not doing right. And so, and then it doesn't really do it justice. And it doesn't. We talk a lot about you both have to show up, and it's a we. It's not about like what are we going to do about the issue? Taking the issue, and rather than being it the person, right, it's the issue, and how are we going to handle it? And when it takes the pressure off the individual that they've got to solve everything because they feel like it's all on me. If I could just fix the interrupting and fix the distractions and fix the forgetfulness, then everything would be great. But it's just not. That's not realistic because of the two people coming in with stuff. So I'd rather just be able to say, okay, you're going to have your things, but now what are we going to do? How are we going to handle this? And as soon as we focus on one person, the boat's sinking. I always talk about a boat, right? Like you are in a boat and you want to make it down the river. It doesn't feel good for anybody, and especially the ADHD person who's been at fault and never good enough and always doing something wrong. It just doesn't really help the relationship.
It doesn't. And I like the boat analogy because I think you're supposed to paddle together. Like that's the idea, right?
Yeah.
And I also think that, not that my ADHD traits aren't a thing in relationships, but I feel like our family systems stuff can be just as powerful. Like the stuff we bring from our family of origin. I don't know. I don't know. Maybe I'm making excuses, but I do feel like that can be so powerful. And like, yeah, I'm distracted. Yeah, I pay the ADHD tax. But, that other stuff, it can be really, to me, it can be really powerful.
Right, right. And I try to bring the compassion to both individuals, that you're going to have things that you're going to be working through, whether it's trauma, anxiety, depression, challenges on whatever it might be. And it's towards both people. Like both people need the compassion, that we're carrying stuff, and I rather say, like, put it all on the table, like let's just all dump it over here, and now we can carry it together, right? Like you're to be in, you're going to be in your boat and I'm going to be in my boat. That's like roommates. Who wants to do that? So we're going to just dump everything together and say, okay, right, we're going to paddle. And sometimes one person's going to paddle a little bit more, and sometimes the other person's going to paddle a little bit more, and sometimes you get a break and sometimes you don't. And but for the most part, you want to be fairly equally balanced. I don't start taking notes on, I've paddled for the last hour and now it's your turn. But we want to be careful of that. So,
Do you ever find that people who call you, they're calling you and they want to come in, or they're Zooming with you, that one of the things that comes up is people pointing fingers. How do you address that? Because I feel like that's one of the things that even comes up in friendships where people are pointing fingers, and to me, there's no good that comes of that.
No. You're so right. And that was the idea when I was saying, like, you're wrong, no, you're wrong. And we could be here all day saying who's wrong. Right? And that almost, I know we started talking about the Four Horsemen before we jumped on the call today. And this is from Dr. Gottman's work, that criticism being the first one we'll mention for a moment, but that's what it feels like. You're just criticizing me. And what do we do if you're going to keep pointing your finger at me, that I'm the one that's, bad, wrong, and so forth? I'm going to get defensive, right? And then I'm going to start shifting it over to you, and I'm going to start blaming you, looking for how you did the same thing, right? You blame me that I didn't do the dishes this week. Well, guess what? Last week you didn't do the dishes. And now we're in the, I feel like we're just going around. Those roundabouts that drive me crazy. I don't know if they drive you crazy.
They drive. We have one in our town, and I will literally drive 15 minutes out of the way and go back roads to avoid it. And I won't let my teenager drive in it yet, because it is it's like written up in like magazines, like about how terrifying this roundabout is. But you can end up just going around and around, like you can't get out.
Yeah, right. And that's what it feels like when a couple is just pointing their fingers going, but you did this and you did that, and we could be here all day. So we're not, and it's exhausting. It's exhausting for a couple, and then we just feel hurt. So where, sometimes I'll be, okay, are we going anywhere? Are we getting, like, are we working on how to help each other, how to fix the situation, improve the situation? I can't make anybody, stop doing that, but the criticism, it's so destructive. And we know that just leads from one of the Four Horsemen from Gottman to the defensive, another one of Gottman, and then I don't know if you want me to talk about the other two, but
yeah, go ahead. No, definitely.
So again, criticism, right? Pointing the finger, saying you, right? And then what happens? The other partner gets defensive, and does the pushback, and comes up with all sorts of reasons and excuses and explanations why they forgot or they didn't do that thing. But then after that, we get into either we're going to have stonewalling, which is you just shut down. One person is going to shut down, and they withdraw, they turn off, they zone out, whatever you want to call that. The conversation's over. And that's, if you go back to the boat idea, that means your partner just fell out of the boat and they're drowning right now, right? They're drowning. They're out of the boat, And what are you going to do? And some people leave them drowning. And what do we do with that? We talk about that in therapy. But the other one is contempt, which is actually the most dangerous of the Four Horsemen that Gottman found, that when we see that in a relationship, and what that means, I know that sometimes people are not really sure, we can see sarcasm, like really, really biting criticism, and then we add some really not nice name calling. I always tell my couples, do you want to call each other honey, sweetie? Have a great time. But the other names people call each other, it's actually contemptuous. And it actually creates a tremendous push towards actually divorce in relationships. Creates tremendous, he calls it citric acid in a relationship. That's how detrimental and difficult not only is it in a relationship, but to get it out. There are antidotes and things that we do to try to shift and ask people to change that mindset. And it's sort of like this one up, like I'm better than you mentality. And again, nobody's going to win here. But unfortunately, sometimes we see that with an ADHD versus non-ADHD partner, that the non-ADHD partner who, they're, paying the bills, and they're, making sure they don't forget anything, and they're getting on, getting to places on time, and all these things that the ADHD partner is struggling with. Sometimes I have couples who tell me, I can't take, I'm just not taking showers, I'm not brushing my teeth, forget exercise and eating healthy. I mean, that's just like... Not even.
No, that's off the table. We're back at like things,
like basic things that they're really struggling with. So now, right, we can, if relationships are supposed to be fair and balanced, like it really starts to shift it in a way that one can start to feel contemptuous and have this like one up, like, look, I'm doing this and I can do that, and don't do that. Do not do that. Look out.
No, and I've seen it. I mean, I've witnessed it. We've all had that dinner where you go out with another couple, and my husband's looking at me like, why did you make me go to this dinner? And sometimes I don't know. It's not like I'm inviting that into my life. But it's always so sad to me because that thing of the criticism and the snarkiness and whatever, it eats away at everyone's relationship. And I guess I'm very sympathetic, but it feels to me like when one of the folks is struggling as much as you were describing, that's a mental health issue, and they need treatment.
Yes.
And just as much as if someone needed treatment for any other health issue. None of us are at our best when we don't have support. And so much of this late diagnosis, I don't know if you ever see people who come in, they describe their life, and you're like, oh, ding, 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 you're ADHD. And they're struggling. And I always say to people, there's sort of like the before the diagnosis and after the diagnosis. And, everything you didn't know, everything that was hard, we have to feel compassion for ourselves because we didn't know.
Yes, I talk about that every day because I do. I literally... on a daily basis have people that have just been diagnosed, or people will tell me like, well, I thought I had this thing when I was a kid, and they're sitting in my office and I'm like, could it be ADHD? Oh yeah, I think I was diagnosed with that, but I don't have it anymore. And I'm like, well, let's look at all the things here. I think we do. It didn't just go and disappear. And one thing that we didn't touch upon, which is a real issue for couples, is the emotional regulation. I talk about this so much. So I do want to bring it up. So
no, please, yes, please talk about this because you've talked about this in speeches I've heard of yours, and to me, it should be a characteristic for diagnosis on the DSM-5.
Yeah, that's one of the first pieces after I assess and really talk with individuals and really get their history, is I move into emotional regulation conversations, because first we have to understand that we get triggered, right? And just to go back to Gottman for a moment, that if we know our resting heart rate, all we need to what we want to understand is 20 points, which That's not a big window, 20 points. 20 points at that moment you hit, let's say it's 80, you go to 100, you will become what we call emotionally dysregulated. He calls flooded, which some people might know as fight, flight, freeze, fawn, other things that are basically just telling you you're going to be really having a hard time, and you're probably going to do one of two things: either be fighting right now or walking out of the room, slamming the door, and having other sorts of, nasty words between each other. So I am talking about this all the time, because if we don't know how to change that, if we don't know how to move out of just letting it escalate, I describe it as, the green, yellow, sometimes orange, and red light, right? Like when you're driving, if my partner comes in and says, oh, I love you, and that's a green light, I'm happy, that's good, right? But if he says something else, it might be a yellow light or a red light. And when you're driving, now you're not supposed to drive, don't drive and go through the red lights, but we know some people who do drive through the red lights.
Witnessed it this morning on my way to get some coffee. Saw someone blow through a red light, and I was like, right. What are you doing?
Right. And sometimes you won't get a ticket, and sometimes you won't get into a car crash. But I tell couples, you go through a red light in this relationship, you are having a car crash. You are having a car crash. You are going to have an issue that now you're going to need to clean up. So, how do you, and it's not easy. We spend a lot of time on understanding what the triggers are. We're understanding what our signs, our physical signs, our body shows signs. We don't, no, you're not triggered. Right? Your narratives, your stories in your head, which was the talk that you listened to last year at the conference. Stories in our head, they get us into a lot of trouble. And then we look at, how do we stop that conversation? Not so easy, but we do need to frequently stop it. What do we do, right? The ruminating, right? Sometimes people will stop it and they'll go like, I have people with Fitbits and Apple Watches and all these things. Oh, I had 100, right? Whatever their resting heart rate was, and 20 points higher, they had it. And then they would go, the next week they'd come in and be like, I don't understand. Like, I left the room, I was supposed to be calming down, and now I'm at 130. What happened? And so then what we talk about is this idea, like you mentioned, the ruminating. If you sit in the room for an hour to calm down, and all you do is run that whole story over and over and over again, and a little bit more, and of course, we are the victim. We are the one that did everything right, and our partner did everything wrong, and they were the bad one. Right? And we pull apart and we run like, I can't believe he said that, I can't believe he did that, and we come out and we're more angry than we just were going in to relax. And so what do we do there? How do we manage that? And actually, I do want to mention this. I don't know if you talk about this, but the ROCD, I always notice when couples are talking about this, the ruminating idea, is it ROCD? So most people are familiar with the idea of OCD, right? So, somebody's, washing their hands, or, takes them 10 hours to clean a little counter or something like that, right? But R stands for relationship OCD. Right? And
okay, I've not heard of this. You have to tell me about this, because I'm like, my mind is going.
Yeah. It's really important. I'll just, I know we have so many things to talk about, but just briefly, and then there's a lot more research on this. There's actually a medication, which I can't remember off the top of my head, that they're finding a little bit that can help this a little bit. But it is when a couple will, like I just described, run the narrative, and not just for like a half an hour, but they will spend all day. They'll even at night not be able to shut off their brain, which is a challenge for some, if not many, ADHD partners to quiet their brain at night, right? So this partner is running the scene that happened, at 8 o'clock in the morning, and now it's 2 o'clock in the morning, and they're still running it in their head, and they're still playing it over and over again. Right? And of course, they're only getting more upset. So the ruminating and the looping, those kind of things suggest, and there's some other things that you'd want to look for, but that somebody might want to note it and, maybe discuss it with their therapist or, psychiatrist, because it's something that you do want to rule out and make sure that if that is happening, that you're getting some support around it.
Just tell me for a second, in relationships, why is this word "but" such a deal? Why is it the thing therapists say, really don't use the word "but"? Tell me, because I know why, but not everybody does. Some people must be wondering why we're having this conversation.
So frequently when one uses it, they'll say, "I love you, but." So now it feels like I just negated this thing that I just said, which is usually is beautiful, right? It's wonderful. Again, I seem to be going back to Gottman a lot today. There's a tool called the soft startup or the gentle startup. And he says, start with a positive and then talk, and then there's a whole sequence of things you say. So a lot of times people will say, I really appreciate that you mowed the lawn and, did the dishes, but, and I would say, take a breath. Just take a breath. I feel frustrated, right? And then you go into the rest of the sentence, because it does feel like, other than negating, you just sort of erased it. Like
you erased
eraser. It's eraser. But so whatever I just said now doesn't exist, and now I just focus on everything else I said after that.
You know what kids often tell me, and it's so true for adults, but kids, the mouth of babes, they often tell me that parents will say, you did this, but, and that they think every compliment then is like they're getting ready, because they know that whenever the parent gives them a compliment, it's going to be but, and it could be, but why can't you do that normally? But why don't you do that? Whatever.
It's negative.
And so I am really conscious of how it negates.
Yeah.
But with the ADHD brain, there I said but again, with the ADHD brain, I think the reason your title, Stop Interrupting Me, is so perfect is because with the ADHD brain, there's so many things that come out of our mouths that we don't even mean, or that we wish we could take back. So with the ADHD brain, you don't say everything perfectly.
Yeah. What
do you tell people about this factor that the ADHD partner, we have a harder time producing these phrases. We have a hard time saying the right thing at the right time.
That's I actually found one of the difficulties with Gottman is that you have to remember. And when you're talking about ADHD, you can't always remember the formula. So actually, my other training doesn't talk about these formulas. And it would say, instead of remembering to say, thanks for doing the laundry and, mowing the lawn, I feel, and go on with the sentence. The other approach says the following. You said the word but, you can do what we call, I've sort of made up some things like, take two, let me try that again. And I just say it again and just do it differently.
I love this. All right, Lisa, you are a gem, and I am so glad I got to have this conversation with you. Yeah. We have so many nuggets here, and I just love your approach. If everyone is listening, please go out, Stop Interrupting Me. It's a great book. There it is.
There it is. I don't know if
there it is. If you ever get to listen to the International Conference on ADHD or listen to any of Lisa's stuff, she is just a breath of fresh air, very neuroaffirming, which I love, because I have heard many folks who are not neuroaffirming, and I think it's not a good place to be. And Lisa is a personal friend of mine. She's someone I value and think is just fabulous. And thank you for coming on. And please, everyone, go out and get her book.
Thank you. Thank you so much, Caroline. I love all the work, and thank you for sharing information out there that people really need to know. So thank you. Thank you so much.
No problem. Thank you.